So good morning. My name is Dr. Mengotna. I'm the doctor. And today I'll share with you about the peptic ulcer disease. As we know, peptic ulcer disease it's a burden in a society because we do receive clients daily. We have a lot of clients suffering in this peptic ulcer disease. So I want to share with you pertaining this peptic ulcer disease in the following scope. So my scope today will be the definition of peptic ulcer disease and the classification of peptic ulcer disease, and to know the etiologies and risk factors for having the peptic ulcer disease, and the presentation and the clinical manifestation of this ulcer, and then how the management of peptic ulcer disease. If you have those ulcers, how do we manage you? And finally, I would like to share with you the prevention of this peptic ulcer disease, and this is a main scope in our society. How do we prevent for these people from suffering with these ulcers? So as I say, I'm Dr. Menko. I'll be with you in this session now. So I will share with you the definition as my scope. First objective is to know the definition of this ulcer. So as I say, the PUD, the peptic ulcer disease, I mean the disease is an ulcer. The term ulcer is an ulceration. So ulceration in the peptic wall. So peptic wall, which is we have like a stomach or there, right? The stomach, the peptic wall. We assume that the peptic. So ulceration, and that is an ulceration found within the peptic wall. So when you define an ulcer, just an ulcer simply is a discontinuation of the epithelial lining that located specific location. If it's in the mucus or mucosa, in the stomach, wall, in the intestine. So if you get the discontinuation of that epithelial layer, that is ulcer. So you have the break over there. So that is ulceration. So when you say peptic ulcer disease, it's simply peptic ulcer disease just is an ulceration, the epithelial lining of the mucus and the peptic wall. I think I'll get you together. Thank you. And then after having the definition of peptic ulcer disease, I will have the classification of peptic ulcer disease. So we have the two types of peptic ulcer disease. We have the gastric ulcer and the duodenal ulcer. It's a simple have been classified according to the location that an ulcer. So in the terms of location, you know the peptic ulcer from the gastric to the duodenum. So in the gastric we have ulcers, and the duodenum we have ulcers. So we have gastric ulcer, also we have a duodenal ulcer. Together we see this peptic ulcer disease. So for you to have the disease means you have to show those presentation that is a disease. So as I said, from the definition, classification, and I'll come to the presentation of these ulcers. So if you do present with those clinical manifestations, they will tell you as you have a disease. So peptic ulcer disease, they do present with the following features. For this patient, because due to that having an ulcer in the gastric wall and the duodenal wall, you may present with abdominal pain, and that is the epigastric pain. Epigastric pain, which is the burning sensation, burning nature. You may present with those. You may present with those what you call the heartburn. Heartburn is like you have a burning sensation, the esophagus from the gastric and then to the esophagus. You will present with those burning sensation. We call the heartburn. So we have epigastric pain, which is burning in nature. We have burning sensation in esophagus, which is a heartburn, and you present with the blood, excessive gas in your abdomen. And this is a typical presentation when you see gastric ulcers or duodenal ulcers. And these symptoms they are episodic, and then maybe they have a relation with food, and then we say now they may present with episodic. Episodic means sometimes we do present with epigastric pain, and some of the time we don't present with this pain. So it will depend on period, time, and related relation to food. And we do say this is episodic and the food related pain. So after knowing those are clinical manifestations, we come to what is the pathophysiology of you having this ulcer. So simple is that peptic ulcer diseases, we have a risk factor of having this peptic ulcer disease. First of all, we have this bacteria known as H. pylori. H. pylori, this is a bacteria which found in, we do consume this bacteria from food, ingesting food. If you ingested the contaminated food having the H. pylori, and then the H. pylori bacteria get access into your gastric mucosa, then stay deep in the gastric muscles. And this is, as you know, this is a microorganism. It needs to survive, so it needs nutrients. The nutrients come from where? The nutrients come from your intestine, your nutrients, so it will utilize you to get its content. So it will excrete its metabolic issues or whatever waste product they over there. So the point where this bacteria hatch over there, or the colony of this bacteria is found over there, so that place become what things, that the place become more deteriorated due to the presence of this bacteria, because it's excrete waste product and then continue to utilize you to get this content. So the place become ulcerated. So if this process is recurrent, most of the time it's recurrent, and then the area become more damaged. So it's a risk to having the peptic ulcer. It's a risk to having ulcer if you have H. pylori, this bacteria H. pylori infection. And if you have this, you have been diagnosed having H. pylori infection, you have to be treated aggressively, and you have to be treated abruptly, because if you allow this H. pylori to stay for a long time in your gastric mucosa, the time where you get access to this bacteria to discontinue, to utilize or to break or to form ulceration into your gastric mucosa. So if this situation is recurrent over the time, you may end up with having ulcers. And second etiology is your abdomen or your gastric to separate more hydrochloric acid as your body needs. As you know, in the alimentary canal, metabolism of whatever, digestion and metabolism of all things do needs a lot of constraints. We have the gastric juice, we have enzymes, and a lot of things. So at the content of the gastric juice, the first content we have hydrochloric acid. I know this is an acid. So if your body do secretes a lot of acid, that acid may irritate your gastric mucosa. If we irritate the gastric mucosa, from the ulceration of the mucosa. So it's a risk of having peptic ulcer if this situation is recurrent, and you do secrete a lot of acid. That is second etiology, or second risk factor for having peptic ulcer disease. But all things have been treated. If you do diagnosed error, you get those medics, or you'll be okay from having those ulcers, right? And so those are the pathophysiology of how you get access to an ulcer. So we have some of other risk factors which may complicate or may initiate or may facilitate you have those ulcers. First is excessive fasting. If you do fast a lot of time, your stomach become empty and you do secrete those gastric juice and a lot of issues, you have a risk of ulcerating your gastric mucosa due to irritation that acid have been secreted to your body. And another issue is cigarette smoking. As you know, cigarette smoking has content nicotine and some carbon monoxide over there. Those will hinder the perfusion of the gastric mucosa. So if the gastric mucosa is poorly perfused, if you have an ulcer, it's may indicate, or it may initiate, may facilitate poor healing of the ulceration. So cigarette smoker, if they have ulcer, they have a good progress, because the ulcer poor healing due to hypoperfusion of the gastric mucosa. Another issue, the use of those NSAIDs, non-steroid anti-inflammatory drugs. These non-steroid anti-inflammatory drugs, they have the tendency of facilitating this having ulceration. So if you do use this aspirin, diclofenac and other issues, they have a risk of facilitating you to have the peptic ulcer diseases. And another issue, the team of management. So in terms of management, we have management plan, various management plans, but the target or the goal plan of managing this H. pylori infection or peptic ulcer disease first is to eradicate H. pylori. If you have H. pylori, the mainstay goal is to eradicate this H. pylori. How do we eradicate H. pylori? So H. pylori is eradicated through medication. We have to target antibiotic. We have to give you PPI, proton pump inhibitor, and you have to use antiprotozoa. So we have a triple therapy. The triple therapy. So we have to eradicate bacteria, we give antibiotics. We have to cover with antiprotozoa because the GI you have anaerobic for them, and proton pump inhibitors to prevent overproduction of hydrochloric acid, which may initiate ulceration of your gastric mucosa. So irritation will be combined with proton pump inhibitors. And then you have as a supportive management like giving you those anti-acid because of burning sensation, pain, and other stuff. And if you present with those recurrent episode of the gastric pain despite having H. pylori treatment, and we are sure that H. pylori have been eradicated, and still you present with those symptoms. So we do plan to investigate more if it's an ulcer. So answer we do the investigation on OGD, OGD, esophageal gastroduodenoscope. This is an scope which has been introduced to mouse to get access into the gastric wall, duodenal wall, so to get the access in the ulcer, we have been located, the status with ulcer. That's the mainstay and the gold standard in diagnosing peptic ulcer disease. So we have no any right to say we have an ulcer unless we do OGD. But all those issues which I've been saying before, those are the risk factors which may predispose you to have peptic ulcer disease. But if you get close with OGD, that is the end of the story, and that's the gold standard to diagnose peptic ulcer disease. And if we do OGD and you get sure that you have peptic ulcer disease, we plan for you for the best management and letting the ulcer, because it's an ulcer found in the gastric wall or duodenal, in the same ulcer found in the mucosa, the same ulcer found here in the skin, or ulceration. So our body, it has well physiology of a tissue repair and whatever. So it doesn't care, it doesn't matter if the ulcer is found where. But it's only supportive management, you get the ample time for the ulcer to be healthy. So the PUD, if you get out from those risk factors and get medication, proper medication and treatment, that ulcer it heal clearly and there is no any complication. But if you get an ulcers and not get access to the proper treatment, you may end up with a lot of complication. Because of a complication in my next session, I'll come with those complication of peptic ulcer disease. If you get an ulcer and you are not well treated, you may end up with those complications. We'll prepare a session for you. And so for here, I'll end up with a prevention of peptic ulcer. How to be prevented from having this burden and the bad disease found in our society. Because nowadays a lot of proportion of people say have peptic ulcer disease or they have H. pylori infection. They present to those manifestations they've been talking about in the past session. So as I say, the risk factors of having PUD, first is a H. pylori infection, second is fasting, and third is cigarette smoking. Yes, is a modification of lifestyle. So lifestyle modification may lead you to get away from having this infection or having this infection, having peptic ulcer disease. First, you have to know the proper time of having food, and proper food, how have been prepared, how have been stored, and the right time to get access to that food. Because you can be well, you can prepare your food, it's a delicious food, whatever, it's a proper preparation of that food. But how do we store that food? Because If you prepare your food in a right manner, proper hygiene, it's okay. But how do you store your food after being prepared? Because the time you are cooking your food, it has a boiling point or high temperature, and no organism may survive in that food. But after being prepared and then you store over there, the temperatures are frozen, and then many of bacteria might come across to that food. So even those H. pylori may get access to that food. So the time you come to get your food in, you ingest that food with those microorganisms. So you can get access to those H. pylori through that manner. And another issue is eating. How do we eat? If we eat something which you are not sure, and it's cold ones, oh my friend, I'm sure you're in a risk factor of having those H. pylori. Like those guys who do prefer to eat salad. You have to eat your chips and those salad, salad, they never been cooked, even boiling. They have been cutted off and they put over there. So we do ingest a lot of microorganisms from those salad. So for my advice as a doctor, you have to stay away, or you have to skip those salads if you're not sure how they prepared, unless you prepare your own salad. And another issue, if you are a cigarette smoker, you have to stop cigarette smoker. Cigarette smoking is bad for your health, not only per se peptic ulcer disease, but general your health status. And after is another issue is alcohol. Alcohol intake also is bad in our health. You have to stop alcohol intake. Stop alcohol intake, because even this alcohol intake may facilitate those other issues occurring in your body, right? Another issue, I said, avoid too fasting. If you avoid too fasting, your gastric mucosa will suffer the consequences of oversecretion of acid, and then irritation of the gastric mucosa, ulceration, and finally get access to an ulcer. Thank you for listening, and I'm sure another issue, I said that do not overuse non-steroid anti-inflammatory drugs. Those diclofenac, those diclofenac, stop over there. Aspirin, these in various research have been done, they show a lot of complication. Among of those is a peptic ulcer disease. You may have discussed having peptic ulcer disease or gastritis due to the long use of those non-steroid anti-inflammatory drugs. Thank you for your attention, and I think I've been trying to cover some of the important issues, but I would like to prepare another session of this type in our native language, so I can get access to a lot of people, a lot of clients in our society, whatever, so as to prevent this burden of having a long population here at the hospital with sent from praying, which is an issue which can be combated here. You live freely. Thank you for your attention. I'm Dr. Menko, so you can get access to me whatever. I'll be available at the hospital daily from Monday to Friday, Monday to Saturday, and schedule time. If you get access to me, my contact is 0744 521692. 0744 521692. Thank you and welcome.